Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is a von Willebrand disease blood test. So let's get started. So before we get into the specifics of the von Willebrand disease blood test, let's talk a little bit about what you can expect when your doctor orders this test for you. So a von Willebrand disease blood test is a simple test that can be done at your closest laboratory. No special preparation is needed for a von Willebrand disease test, which means you don't have to fast, so you can eat and drink as usual before the test occurs. So during the test, a blood sample will be collected from you, which means that a needle will be inserted into a vein, usually in your arm, to draw out some blood into a blue top, which is also known as a citrate blood tube. This blood is then sent off to a laboratory where it is analyzed and resulted. So what is von Willebrand disease or VWD? So von Willebrand disease is a genetic bleeding disorder caused by a deficiency or dysfunction of von Willebrand factor or VWF, which is a protein that plays a crucial role in blood clotting. So von Willebrand factor helps platelets stick to the blood vessel walls and to each other, which is essential for forming blood clots and stopping bleeding. So von Willebrand disease is typically inherited from one or both parents. It can be passed down in an autosomal dominant or recessive manner, depending on the exact type of the von Willebrand disease. So symptoms of von Willebrand disease can include bruising easily, bleeding from the gums, frequent nosebleeds, which is also commonly known as epistaxis, very heavy menstrual or long menstrual periods, and prolonged and excessive bleeding after a cut, injury, medical procedure, or childbirth. So if we take a closer look at this image down at the bottom of our screen, we see that in order for a healthy clot to form in a damaged vessel, we need fibrinogen, factor VIII, and von Willebrand factor. So fibrinogen rushes to the site and is cleaved to form fibrin, and the platelets here will aggregate by binding with fibrinogen. The fibrin is then cross-linked by factor VIII, and the platelets adhere to sites of injury by binding to von Willebrand factor. So as we can see, these little platelets stick to the blood vessel walls and each other only because of von Willebrand factor. So if we have a disorder, such as von Willebrand disease, where there is a deficiency or dysfunction of this von Willebrand factor, we're going to have a major issue in the clotting of our blood. And this is now going to express in the patient as bruising easily, more frequent bleeding from the gums or the nose, or usually the soft tissue mucosas, and in women, very heavy menstrual cycles, or just excessive and prolonged bleeding after slight injuries. So now that we know what von Willebrand disease is, let's take a closer look at what the von Willebrand disease blood test is all about. So a von Willebrand disease blood test is a diagnostic test used to detect von Willebrand disease, which, as we mentioned in the previous slide, is a genetic disorder that affects the blood's ability to clot properly. So this test measures the levels and functionality of von Willebrand factor, which is a protein that is crucial for platelet adhesion and clot formation. So there we go, we can see down here we have our citrate or blue top blood tube, and this is actually sent off to the laboratory where we can now test for this von Willebrand disease. So what are the normal ranges of the von Willebrand disease blood test? So there are actually several components of the von Willebrand disease blood test. So these are all the different subcomponents that make up the full von Willebrand disease blood test. So in this blood report, we have number 1, von Willebrand factor antigen. So this measures the amount of von Willebrand factor which is present in the blood. And a normal range here would be 50 to 100% of the activity level. The second component that makes up this blood test is the Ristocetin cofactor activity, and this assesses the functionality of the von Willebrand factor by measuring its ability to help platelets clump together. And here, the normal range is also 50% to 150% of activity. The third component of this blood test is the factor VIII activity. So von Willebrand factor also stabilizes factor VIII, which is another protein that is involved in clotting and is quite essential to the clotting process as well. So the factor VIII activity test measures the activity of factor VIII, and the normal range here is also from 50 to 150% of activity. The fourth component making up this blood test is the von Willebrand Factor Multimers. So this analyzes the size and structure of von Willebrand Factor, helping to identify the specific types of von Willebrand disease. A normal result here means a normal distribution of von Willebrand Factor Multimers of varying sizes in the blood. And the fifth and last component of this blood test is the platelet function tests. So sometimes additional tests are done to evaluate how well the platelets are functioning. And here the normal result obviously would be normal platelet aggregation and function. So if the platelets are clumping together and adhering to one another and being able to properly seal off that blood spillage, then it would point away from a von Willebrand disease. So these are the several components that make up the von Willebrand disease blood test. The interpretation of the results. So lower than normal levels of the several components of the von Willebrand disease blood test suggest a diagnosis of von Willebrand disease, especially if accompanied by a family history of von Willebrand disease or the symptoms of bleeding like we spoke about earlier. So higher than normal levels of components of the von Willebrand disease blood test may occur in response to stress, infection, inflammation, or pregnancy, but are not typically indicative of von Willebrand disease. So if we find abnormal multimers, this can help classify the specific type of von Willebrand disease, which is critical for determining the appropriate treatment. And it's important to remember that von Willebrand disease is diagnosed through a combination of medical history, physical examination, and specialized blood tests, including the von Willebrand Factor blood test, like we just spoke about. And family history here is also very important, as von Willebrand disease often runs in families. So as we have just seen, the interpretation of the von Willebrand disease test results requires careful analysis by a healthcare provider, considering the full clinical picture, family history, and any associated symptoms. So a diagnosis of von Willebrand disease often involves multiple tests and may require repeat testing to confirm the results. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. So I've also just signed up for Buy Me a Coffee. So if you want to encourage me to do even more or to say thanks for all the free information you've received on my channel today, you can buy me a coffee by clicking down in the description box below for the link. Take care and have a wonderful day further. Bye for now.